What is the psychological impact of diabetes hypoglycemia? Imagine feeling fine one moment and then suddenly overwhelmed by nervousness, confusion, or even fear. That's what happens during a hypoglycemic episode in people with diabetes. When blood sugar drops too low, it doesn't just affect the body, it hits the mind hard. The brain relies on glucose for energy, so when levels fall, cognitive functions like attention, memory, and decision-making can suffer. This can make it hard to recognize symptoms or respond quickly, which increases the risk of more lows. At the same time, the body releases stress hormones like adrenaline and cortisol to raise blood sugar. These hormones cause physical symptoms such as a racing heart, sweating, irritability, and feelings of anxiety. These symptoms can be confusing because they mimic anxiety or panic attacks, making it difficult to tell if it's a low blood sugar or just anxiety. Over time, repeated episodes can lead to ongoing feelings of worry or fear about having another low, which can interfere with daily life. Many people with diabetes develop a fear of hypoglycemia after experiencing severe episodes that might have caused loss of consciousness or hospitalization. This fear can lead to behaviors like keeping blood sugar levels higher than recommended or avoiding activities like exercise. While these actions might seem protective, they can actually make blood sugar management harder and increase the chance of long-term health issues. Hypoglycemia also impacts mental sharpness. During lows, cognitive functions such as attention and decision-making decline. This can be dangerous because it might prevent someone from recognizing symptoms or taking action to treat the low. It creates a cycle where fear of lows causes people to keep their blood sugar higher, which then increases the risk of hyperglycemia or high blood sugar. The emotional toll of hypoglycemia can make managing diabetes more stressful. It can cause feelings of frustration, helplessness, or sadness, especially if lows happen often. This emotional stress can reduce motivation to stick with medication routines or blood sugar checks, leading to poorer control over time. To manage these psychological effects, it's helpful to monitor blood sugar regularly, learn to recognize symptoms, and work with healthcare providers to adjust medication if needed. Relaxation techniques, physical activity, and social support can also reduce stress and anxiety. If fear or anxiety about lows interfere with daily life, seeking mental health support can be very beneficial. In the end, addressing the emotional impact of hypoglycemia is just as important as managing blood sugar levels. Both aspects work together to help people with diabetes feel more confident and in control of their health.